watchful waiting is no longer recommended for pediatric obesity. That was the stance in the past, but now it's time to intervene and intervene sooner rather than later. Again, for all of those possible complications of obesity that can develop over the years and decades, but also because the kids are having health problems, as I mentioned, obstructive sleep apnea or problems with bone growth, having that extra weight on growing bones, things like that. So it's time to intervene. They offered 3 suggestions. One was the intensive health behavior and lifestyle treatment, which the other was the anti-obesity medicine and the bariatric surgery.
Growing a Healthy Child, where we help busy parents grow healthy kids with less stress and more joy.
Welcome to Growing a Healthy Child. My name is Carrie. I'm a pharmacist and board member at Plant-Based Nutrition Movement.
And my name is Meryl Fury. I am a registered nurse and president and CEO of Plant-Based Nutrition Movement. And tonight we are going to speak with someone we're getting to know a lot about, Dr. Leigh Ettinger. Hey, Dr. Ettinger, can you introduce yourself for us?
Sure. First of all, thanks for having me on. And my name is Leigh Ettinger. I call myself like a plant-based pediatrician obesity specialist. That's really my area of interest, is trying to address the obesity epidemic with the plant-based diet for the children.
Nice.
Thank you so much for doing that. Yeah. And thank you for being on our podcast. This is excellent. We've been looking forward to this for at least a couple weeks, at least, right?
Well, first of all, you should say our topic for today, and the question that we will answer by the end of the episode, is 5 things that parents or children can do to reverse the trend towards obesity when they're already maybe headed in that direction. So by the end of this, you'll have that answer and we will discuss that now. So what are some of the causes or factors that you see that are contributing to this obesity epidemic?
Well, yeah, this is what I talk to about families. First, I try to reassure the families that this is not anyone's fault. There's a big stigma in our culture and our society that obesity is a character flaw or a lack of willpower. But what I try to support my families and explain to them is that we are in an evolutionary mismatch, in that Homo sapiens has been around for 250,000 years. And for most of that time, we were in search of calories because calories were scarce. So all of our senses evolved to seek out and find those calories. And then our reward centers in our brain would get very happy if we found something that was caloric, because it meant we were going to survive another day. So we have this instincts to want high calorie foods. And now we're in a situation where there's high calorie foods around us all day long. So we're in this evolutionary mismatch. So it's just no amount of willpower can really fight 250,000 years of how we were evolved or designed, what have you. So I try to reassure people that it's not their fault. And what I really try to help them understand is to change the environment rather than to change the person. And the way I hope to enforce or encourage people to change the environment is by going plant-based, because that creates scarcity again. All of a sudden there's less aisles in the supermarket to go down. There's less restaurants to eat at, less menu items to select from. So when you go plant-based, it kind of hopefully restores some of that balance of calories that are available to us.
That is so brilliant. Yeah. I love that idea, right? Mm-hmm. Because absolutely, when parents go in the store, anybody, doesn't have to be a parent, it could be, anybody, you go in the store and you're absolutely assaulted with everything, to include the smells and the design of the grocery store to get you to go through the entire store, right? Yeah. So really, really good to be able to give people a way to minimize the assault, minimize the insults. Yeah, that's great. Yeah.
So then how much would you say our genes contribute? Because some people maybe think that obesity is a large part genetic versus lifestyle and nutrition. So what would you say to that?
Right. So there are actually several known gene variants that do cause childhood obesity. There are 79 of them. And in my practice, I can order a cheek swab, and you swab your cheek and send it off to the lab. And within a few weeks, you can find out if you have one of those 79 genes. So there is definitely a genetic component for some people, but that's a very small minority. For the rest of us, yes, there is a concern that there's a genetic component, because there are studies that show that if one or both parents have obesity, then the child is a 75, 80, 85% chance of having obesity too. So that makes it appear to be a genetic result of our genes. But then you also sit back and say, well, the family's eating around the same dinner table, so how much of it is the environment? But when I think about the genes, I think about how, again, going back to evolution, is I wouldn't blame someone drowning in a tsunami and say, oh, it was their genes' fault. They didn't evolve gills or flippers. I kind of think about it the same way, is that we're under a tsunami of calories now, and we just didn't evolve the genes to deal with that. In fact, obesity is our body doing the right thing. 100,000 years ago, if you found some extra calories, it made sense to pack them away as fat to prepare for the upcoming famine, the upcoming winter. But now in this part of the world, at least, that famine isn't coming. And so all those calories that we've stored away are just being held on to. It's our body kind of doing the right thing, but at the wrong time.
Yeah.
So how do you see it happening in the lower income neighborhoods, where there's just such a high prevalence very often of low quality, high calorie, poor nutrient type food? And we see that the children that grow up in those environments have a higher risk of obesity. Do you see that in practice?
Yeah, I was encouraging one family to eat more plant-based, and the young man says, my family shops at the corner store, and a banana there, one banana cost $3, not a bunch of bananas. It was one banana cost $3. So it was hard for me to encourage him to eat more fruit when this family had limited resources to pay for. Who wants to pay $3 for a banana? So yeah, the food deserts, the food insecurity that people are experiencing, I learned a new term a few weeks ago, food swamps, in that I'd never heard that before, but where all that's available is highly processed foods, high calorie density foods with very little nutrients in them. So unfortunately, there is a lot of food inequality in our system, in our society, and yeah, people with limited resources, with limited budgets for food, are unfortunately not getting the organic bananas or the healthy fresh fruits and vegetables that can really help them fight obesity.
Right.
Yeah.
It's frustrating. It's a frustrating system that we're in, I should say.
Yeah.
For the people with limited resources, I didn't want to leave it hanging that they can eat plant-based, or that if you can't get fruits and vegetables, you're doomed. I like to encourage starches. So eating rice and beans and corn and potatoes. I eat a lot of that all day long. I can afford a steak, but I don't want the steak. I want to eat these starches that in some parts of the world are called staples and have sustained whole civilizations throughout history. So, so someone with limited resources, I encourage them to eat the starches and fill up on the starches. Oatmeal, pastas, things like that are very affordable in the markets. Even if you have limited access to fresh fruits and vegetables, you can still thrive on the plant-based diet. I just wanted to offer that.
I read an article the other day that was saying that even in areas that we, label food swamps and food deserts, now with Instacart and Grubhub and DoorDash, a lot of those areas now, I think something like 93% of the areas that would be called food swamps or deserts have access by having Instacart or Grubhub or one of those bring the groceries to them, which is really, really a godsend in a way. I mean, you may have to come up with a little bit extra money to pay the tip for the person who's driving or whatever, but nothing compared to $3 for one banana. Certainly not that. Yeah.
And I guess you would still need some phone or computer and an internet connection also for
and most people most people have smartphones anymore. That's almost it's pretty common. Most people have that, I think.
And then as I got more into the plant-based diet, I got the certificate from eCornell on plant-based nutrition. I got board certified in obesity medicine, and I joined my hospital's pediatric weight management program, and started to see families struggling with obesity with other comorbidities too, like even type 2 diabetes, which when I was in medical school in the 90s was called adult onset diabetes. But now we're seeing kids as young as 8 years old with it. So it's no longer adult onset. So yes, seeing these complications, high blood pressure, diabetes, it was very upsetting and motivated me to use what I've learned about the plant-based diet to try to help families with these, prevent or reduce these complications and practice healthier eating. What I have read about, actually, it's interesting, is we talk about obesity specifically as a risk factor. It's a risk factor for over 200 diseases later in life. It's a risk factor for infertility, for kinds of cancers and stuff. So we worry about our kids with obesity for these risk factors later in life. As I said, sometimes they're developing diabetes and hypertension now, but there's also actually issues going on right now that should be addressed. For example, obstructive sleep apnea. So kids with obesity, it's thought maybe 60% have some form of obstructive sleep apnea, so they're not getting a restful night's sleep. And that can lead to fatigue the next day. And even the ADHD might be the child frantically staying in motion to not succumb to their exhaustion. And being tired and exhausted from a poor night's sleep because of the obesity and the obstructive sleep apnea can lead to lower grades. So I haven't seen it personally, but I know that there are studies that showing that weight loss can improve obstructive sleep apnea and then go on to help a child achieve more in school and be healthier overall for just getting a good night's sleep, a better night's sleep. So there's that aspect.
Yeah.
So in your practice, when you recommend healthier lifestyle changes and eating habits to your patients and their families, how does that usually go? Do people seem like they find that really difficult in the beginning? Are they resistant? Are they hesitant? Or do people see benefits early on so that they buy in?
Do they just say, yeah, give me some of that? Give me that.
It really varies. There's a lot of variables, but I try to understand their cue to action. So what actually brought them to the doctors? Again, in the hospital-based setting, families were sometimes referred to me at the pediatric obesity clinic and didn't even know why they were there. They were like, "Oh, we were just told we should come see Dr. Herbivore." So they'd be very surprised. Yeah. So, but the cue to action, understanding. So this is the reason why someone goes to seek medical help and might change their behavior. So it might be a new diagnosis, like finding out you have diabetes, or it can even be a friend or hearing news about a friend or family member being diagnosed with something or having a tragedy happen or something like that, that would make a person say, "Oh, I should go get that checked out." So they go to the doctors. And so someone might have a headache, but you try to find their perceived threat. So the headache brought them to the doctor. That might be their cue to action, for example. But what they're really worried about is the brain tumor, the rare thing. So once I try to figure out what brought the person to the doctor and then what they're really worried about, then we can build on that about making the health behavior changes, because then I want to understand what the perceived benefit is. So like, okay, you came to the doctor with a concern about your weight, you're worried about diabetes. Now, if we do make a change, what's going to happen? What do you think? What is the goal here? And for some, it's interesting, the teenagers, the benefit and the threat might not actually be connected. So I had a young lady who said, I'm concerned about my weight, I'm concerned about diabetes like my aunt has, but if I can lose a few pounds, I can look great in my prom dress. So that was the benefit. So once I understand the cue to action, what brought them to the doctor, their perceived threats, their perceived benefits, then I want to dig into the barriers. So these are all the myths that someone throws up that we kind of self-block ourselves, like, oh, the gym's too far away, or I don't have time to exercise, or eating plant-based is too expensive. So trying to break down those barriers in dispel the myths. Again, reflecting back to someone, okay, well, yes, that barrier is there, but we really want to avoid the diabetes. We really want to look good in our prom dress. How can we work through these barriers? I don't have the answers. I want to help someone come up with it and figure out in their own life how they can make either baby steps or big steps towards that goal that they want. So hopefully there's not a lot of resistance to the changes, and that we can overcome the barriers.
Yeah, I think that's so important to figure out their why, basically, and what they see as their reason for wanting to make healthier changes. And do you see more often that for at least the children, that because most of the time, at least I imagine, most children are maybe not so focused on the health aspect, but do you see that they're more focused like on the prom dress or something else like that as their motivation?
Yeah, and this is what I especially like about the plant-based diet is especially, no 13-year-old is worried about their blood pressure,
Right.
It's just not.
Right.
But the young adults, the teens, perhaps there's some, if they're into pop culture, some musician or actor that is also plant-based that they can identify with. Because I had one young lady who was spending her weekends with a group cleaning up the parks. And I was like, oh, that's really wonderful that you're acting locally. Let's think globally about how our food choices affect the environment. For the athletes, I suggest the Game Changers documentary. So I really want to try to figure out, for some kids, they might like cooking, and this is a new challenge for them to learn how to cook or bake plant-based. So I really like to try to figure out what the child's interest is. And we don't even have to talk about the scale or weight or diabetes or stuff. Let's talk about how we can go more plant-based for these other reasons. So that's a nice key bonus, positive argument for the plant-based diet.
Yeah.
Do you see that the parents are particularly supportive or engaged or willing to make that leap? I've heard other doctors say that they'll talk to the children and say, we need to change the diet because we want to help your mom and dad. We want to keep your mom and dad healthy, right? And then I wonder, do the parents like push back and say, well, I'm not going to give up my Diet Cokes. I'm not going to give up, my foot-long subs or whatever it is, right? Do you ever see that dynamic happen?
Yes, absolutely. Or one adult in the household is throwing another adult under the bus, like, oh, of course I make healthy meals for my kids, but grandma is cooking them dinner 3 nights a week while I'm at work, and she just gives them cookies and ice cream for dinner. And so I'm like, okay, well, bring grandma to the visit, and let's talk and meet grandma and work with grandma. That's the beauty of doing telemedicine now, is that I can really try to make it more convenient to engage with all the family members that are either purchasing or preparing food for the family. But I asked the families, the adults in the household, to be good role models, because if they're sprinkling bacon bits on their dinner and not letting the child have them, then the plant-based diet is going to seem more like punishment. So we need good role models in the household to show how enjoyable and tasty and health promoting the plant-based diet can be.
Yeah. So on the flip side of that, do you see parents that are really invested in kids, maybe not so much? And then like, especially, I know we were mentioning earlier about the like the ADHD and the autism, and I know you may not see a lot of those patients, but they can often be very like picky eaters and not really wanting to branch out and try new things. So what would you recommend or how would you recommend a parent try to improve their child's diet in that situation?
Yeah. I had one family, the mom was like, oh, Junior stops at McDonald's every day on the way home from school. He's the lost cause. but look at this great cashew nut recipe, cheese recipe I found online. And she wanted to talk recipes with me, yeah, that can be frustrating and challenging. And again, trying to find out what the young adult is into, to try to make it seem more real to them, more so rather it's not the adults in the room telling them what to do. It's the adults hopefully listening to them and hearing again, hopefully what they might be worried about, what they hope to achieve, their benefits to making this change, and understanding. But yeah, it can be tough. Teenagers they're feeling pretty invulnerable, and
Right.
so,
Right.
we're
right.
only, a line from one of my favorite rock bands says, "We're only immortal for a limited time." So,
Oh.
I like that.
yeah, it can be a challenge to get through the teenagers. But then, some teenagers they want to rebel, and for some that might be smoking or vaping, and for others it might be going vegan. Let's annoy everyone else by going vegan. So I fully support that form of rebellion.
Are you a parent or caregiver who is unhappy about how your child eats at home?
Wouldn't it be great if you were part of an active, well-informed, supportive community where you could work to transform how we feed our kids so we could make a difference for them and for the planet as a whole?
Well, you can. That community actually exists.
It's a thing.
It is. Join us and get involved. Become a member of Plant-Based Nutrition Movement. There's no cost to join. Join the 6 Million Seeds Coalition and launch a 6 Million Seeds project in your area. Contact us at 6mseeds@pbnm.org.
We want you there. So how tough is it? Well, you're in upstate New York, right?
Yes.
So how challenging do you see the school lunch program? How challenging is it in the world of pediatric obesity?
Yeah, very, very challenging. You mentioned the American Academy of Pediatrics. They came out with the clinical practice guidelines, and some of the reaction was like, oh, the system has failed. Now we must do surgeries on kids. Now we must do medicines for kids with obesity. But I'm like, the system hasn't failed. The system's getting exactly what it was designed to get. You give kids really unnutritious, calorie-dense lunches, and then now you're surprised that we need to start this extreme measures for their obesity. So yeah, it can be very frustrating. Actually, it's nice though, in New York City, the mayor Eric Adams, he is plant-based and had a big 180 of his own health going plant-based, and is really encouraging people in New York City to learn about the plant-based diet. And he made a vegan Fridays for the school lunches, that actually didn't go over too well initially because there was a lot of processed vegan food that was put on the plates initially. I don't know what's been going on lately with that, but there was a lot of blowback about that, vegan Fridays. But yeah, at least at the government level, there in New York City, he's trying to push or encourage healthier school lunches. But yeah, it can be very frustrating. And then another thing, one of my families, the mom was making a very nice plant-based lunch for Junior, and he was eating that lunch and getting the school lunch. So,
who doesn't love two lunches?
Yeah, it's like bonus. So yeah, sometimes we have to be careful with our messaging to make sure that the healthier options are being eaten. But yeah, I don't have an easy answer for that, except that I know that Mayor Adams' office is working on modeling these kind of programs for other cities. They're also he recently instituted a optional CME program, continuing medical education, for all the healthcare providers, doctors, nurses, physicians, assistants in New York City. And it's a 6-hour video course that you can take as a doctor in New York City to learn about nutrition and lifestyle medicine, stuff that we weren't taught in medical school. So again, these are great pilot programs for New York City that he's hoping spread across the country. So we'll
Well,
see.
I want to ask too about those American Academy of Pediatrics guidelines, just a little bit more.
Yes.
So I know it has been hot topics among pediatricians and certainly among public health professionals. Like, there's just so much there to look at. It's a hefty document on top of it, right? And it's the
Yes.
first guidance that the AAP has come out with ever, I believe, on obesity, right? So and it indicates a pretty marked change in the stance, right? So could you tell us a little bit, just for your 100-page down to 3-sentence synopsis of what that's about? And then what are your colleagues saying? What do you hear other pediatricians saying about the guidance when you get together behind closed doors?
Yes, right. It's a very lengthy topic. Basically said that watchful waiting is no longer recommended for pediatric obesity. That was the stance in the past, but now it's time to intervene and intervene sooner rather than later. Again, for all of those possible complications of obesity that can develop over the years and decades, but also because the kids are having health problems, as I mentioned, obstructive sleep apnea or problems with bone growth, having that extra weight on growing bones, things like that. So it's time to intervene. They offered 3 suggestions. One was the intensive health behavior and lifestyle treatment, which the other was the anti-obesity medicine and the bariatric surgery for kids. But I'll focus on the intensive health behavior and lifestyle treatment. And unfortunately, it was very vague. It said something like the line was a non-diet, a lifestyle approach that encourages good nutrition, but then also said with portion control and label reading. So, portion control and label reading sounds like a diet to me, but they said a non-diet lifestyle. So it's kind of contradictory.
Yeah. I think about the plant-based cultures in the world, or the cultures where they're eating not so much meat. So a quick one that comes to mind is in Hindu cultures, not eating a lot of actual meat. They may be eating dairy and cheeses, things like that. But vegetarian is very common, right?
Yeah, around the world. And even in India, where, yes, the culture is vegetarian, they're having an obesity epidemic too, mostly as their diet is westernized and is more reflecting ours with all the fast food and processed foods. But even without the meats, there are other cultures that and other societies that are struggling with obesity. The Middle East is developing a lot of obesity too. So yeah, this is a worldwide problem. We're leading for better or worse, but it is becoming a worldwide problem. Yeah.
So you do telemedicine. Tell us how, or tell our listeners how they can find you if they'd be interested in having a session or so with you.
Sure. Yeah. So I'm licensed in New York and New Jersey, so I can practice telemedicine in those 2 states. You can go to my website, drherbivore.com, all spelled out. And you can even make an appointment with me for a free 15-minute consultation, and we can talk and see if I can help you achieve your goals. I really have 2 goals with the telemedicine program. One is for pediatric obesity. I have a 12-week program where I've partnered with a plant-based chef and a plant-based youth fitness expert. And so that via telemedicine, telehealth, I can meet a family, work with them, blood test if needed, the genetic test if needed, also get them plugged in with the chef and the fitness expert. And over the 12 weeks, really work on the obesity, as well as an e-course that kind of breaks down how the plant-based diet can really help someone with obesity. So there's kind of homework for you. So that's a 12-week course. There's a 4-week course also where I was, talk about getting frustrated. I'd be frustrated as I was working with families and trying to encourage them to eat more plant-based, and they come back to me and say, "Oh, my pediatrician says I need to eat meat. I need to drink milk." So I have a 4-week program to work with a family on raising if they're deciding to raise their child plant-based or vegetarian, how to do it right. So these families, they're getting the information about the animal products from the pediatrician, but I offer an e-course, again, working with the plant-based chef, blood tests if needed, and really trying to teach a family how to optimize nutrition and avoid deficiencies, and really reassure the pediatrician that that they're meeting all their growing child's needs. So that's what I'm doing in New York and New Jersey. For other families who are outside those states or don't want to do the full programs, the e-courses are available too, so that you can kind of do your program at home, working on the obesity or learning how to maximize the nutrition for a family. And then I have a third e-course teaching families who are plant curious how to go plant-based and how to really make the switch. I talk about some of the things I talked about here today, like finding your cues and the benefits, and there's a worksheet there, and it's kind of a multimedia course. So all that's available from the Dr. Herbivore website.
Yeah.
Really good.
Yeah.
Are you on Instagram or any of those other things, or?
Yes, I am. On Instagram, I'm the Dr. Herbivore. At the @ symbol. I'm on LinkedIn. I have a very tiny YouTube channel where I've shared some cases, kind of educational cases, like 12-minute videos where I go over how the plant-based diet or eating more plants kind of help families. So just kind of get a sense as to how this works for helping families lose weight or improve their nutrition. So yeah, little YouTube channel.
Is there anything you would like to tell our audience? One last
piece of advice.
Yeah.
About
something they could do. Let's try this.
Yeah.
Something that they could do right now that wouldn't be too painful, too scary, too threatening, that could make a difference.
Yeah.
Have a piece of fruit.
Easy.
There you go.
Feed your microbiome all of the good fiber and water and nutrients in the fruit. I'm a big believer in eating fruit. I think it can solve a lot of the world's problems if we eat more fruit and less animals, fruits and starches. And keep listening to the 6 Million Seeds podcast.
Oh, thank you.
What a guy. Well, Dr. Leigh Ettinger, it has been such a pleasure to speak with you. I look forward to speaking with you again and more often.
Yeah, and thank you so much for the work that you do. It is such an important message to get out there that we need to start emphasizing healthy lifestyle in children, because that is where that is where we can make the most difference. And we don't need children to have to grow up with these health issues. So starting out as a child and making healthy choices is really important. So
building that habit early on. Thank you so much.
Well, thanks for having me. This was a lot of fun.
All right, Dr. Ettinger, we will see you soon and more often. I hope so.
Yes, thank you. Keep doing the good work that you're doing, spreading the plant-based message for families and kids. I appreciate you too.
Yeah, absolutely. It's our pleasure to work with you on this journey.
Yes.
Thank you.
All right, we'll see you. Bye-bye.
Bye.
Bye.